Assalamu alaikum, everyone, and thank you for that warm welcome. What I was going to do before I start the presentation is just to let everybody know that oftentimes when we discuss, such an important topic, it can trigger a lot of things for people, whether you have experienced this or you haven't, or you've seen somebody else experience child abuse. Just bear in mind that if the talk does get a little bit too much, then you can pull away, and then I'll give you some numbers at the end that if you choose to wish to contact people in the event that you want to discuss this further. So I guess I'd start off with what is actual child sexual abuse. So when we talk about sexual abuse, there's obviously this preconception or preconceived notion that it's always about sex. But it's not necessarily the case. Child abuse can include a range of sexual behaviors that can be physical, verbal, or emotional. Physical doesn't always necessarily lead to having sex or penetration, and verbal could just be comments that are made to the person that are very derogatory in nature, and emotional as well. So they're both used interchangeably. And oftentimes children are abused by someone that they know. So often, and it often starts, when they're very young. So usually between the ages of 2 all the way through to about 7, 8, or 9. So, I have had cases where it's been disclosed that the young child would have been 2 years old, where they were actually severely sexually abused by their father, or someone in their immediate circle. And it's not just a generally one-off isolated incident. When we talk about child abuse, it can happen over a period of time, depending on the perpetrator and depending on the child, their age, and whether they speak up about it. What you'll notice is oftentimes they use like threats, tricks, or bribes, to keep the child from telling everyone. So some of the common themes that we've noticed is that, it's a secret between us. Make sure you don't say anything to anyone. This is normal. These things happen between two people that love each other. And even if you say something to someone, nobody's ever going to believe you because, you're still a child. And so those kind of things oftentimes prevent and create a sense of fear in the child, hence the reason why they don't disclose or to anyone in their family until they're very, very, in their adult years. And even then, sometimes it becomes very difficult for them to disclose. When a child at the age of 5, 6, or 7 goes through sexual abuse, it causes a lot of harm to them. So oftentimes children will have lots of trauma. So that's usually the first issue that they experience, is the trauma that they have to live with. Particularly whether penetration was done or not done, it doesn't really matter. The incident itself, however it was done, is traumatic for the child. So, and it causes a lot of discomfort for them. So particularly as they grow into adulthood and then they develop relationships with their own partners going forward. And oftentimes we've noticed that the effects of child sexual abuse, can last a lifetime. People don't get over it. People always have this assumption, well, it happened, when she was 8 years old, she should be by this stage, she's 35, she should be over it. It doesn't go away as people would believe it to be. So there is that fear and that stigma that also and the stereotypes that exist within our cultures. Oftentimes, in different cultures around the world, it's become very normalized. So it's very hard for people to understand that it actually is against the law, and Islamically it's also against Islam. Islam in no way promotes something like this. In fact, it prohibits it completely. So that is where the issue often lies, is that our cultures oftentimes dictate something else. I've had people, I've had young girls from South Africa who've been sexually abused by, someone quite, whether it's someone they knew, by their brother, for example. And they will usually say, you know, but my parents said this is normal. You know, this is something that normally happens in our culture. So by doing that, we are not breaking away from that stigma or from that stereotype, or even acknowledging that it's something unlawful to do. There are various types of sexual abuse. So you know, things like child prostitution, um, even oral sex, speaking with a child in an explicit way that the child really doesn't understand. And that's why I always tell parents, one of the most important things that when you do child education or sex education with your child is that when you talk about their private part, you be very explicit with them. When you start to say to them, you know, make sure nobody touches your flower, or maybe nobody pops your cherry or things like that, or no, you know, even for a male, we don't give it names, okay, because that's what the perpetrator uses to their advantage, you know. So we try to educate them in a way that's conducive to their learning. So you give it the name that it's given. So I'm sorry to say this, but I will be quite explicit in the language that I use, because you know I have to be. But it is your vagina, or it is your penis, and so that's what they need to understand, because the language that the perpetrators use is, they know that the language that the families use, or the mother would use, or the father would use on the child. So it's very important that we don't use any kind of, give it any kind of meaning than it is. There's also taking pictures, videos, or of the naked child, and sometimes they do it when, you know, the child is in the playground, for example, and on the swing. You know, they could be someone sitting across and just taking pictures of the child. That's still classified under Australian law as sexual abuse. Asking or making the child touch their genitals or perform sexual acts, or forcing a child to watch a sexual act. And I have seen this as an example in a recent case. I had a 14-year-old girl, when she was 8 years old, was actually forced to watch her mother be raped by four men. So that scenario is very common, and so they will make them watch the entire incident. So she said she was numb. She couldn't process anything, and all she did was think about that particular incident. And persistently intruding on a child's privacy. So for example, if a child is 8 years old, you don't take them to the toilet. If a child is, you know, can shower herself, you don't, as a father or a grandfather or an uncle or a mother or whatever, you don't get into the shower with the child. You know, because at 8 or 9 or 10, there's an expectation that the child should have enough skills to be able to wash themselves, dress themselves, and all of that. Or exposing their genital parts, you know, to the child, kissing them inappropriately, like kissing a child, even like uncles and aunties and whatnot. Kissing a child on the cheek is more than enough. But when it gets to different parts of the body, like the neck area, the back area, or the tummy area, that's not acceptable. And when a child says, no, please, I'm uncomfortable, perpetrators don't really understand and regulate that information really well. So it's up to the parents to step in and actually say, can you stop doing that? Because my child is clearly uncomfortable. And it's up to the parent to educate the child that if you are uncomfortable in the presence of A, B, and C, then you should be able to speak up about it. And the most common one we've seen is making sexual comments to a child on the phone or online or in person, and that is ways of sort of gauging whether the child will respond to the perpetrator. The biggest, there's stages of sexual abuse for perpetrators. So oftentimes the stage that they go through is called grooming, which is a gradual process to prepare a child for sexual abuse. So it really is using lots of pervasive and manipulative tactics to gain the trust of a child, and sometimes their caregiver, by developing a bond. So for example, if you've got a new friend introduced into the family, then and they become really close to you as parents, and then they start to become really friendly with your child, to me that's alarm bells. you know, and friendly in a way that you as a person would think this is not appropriate. um, and sometimes they start with the sexually abusive touch or behaviors, and you'll see that. So the forceful act of hugging them and lifting them on their shoulders, particularly if they've just recently met them. And sometimes it's very carefully planned, and it can take place over several weeks, months, or even years. So it's not, you know, somebody decides that I like this particular girl or boy, and I'm going to go and sexually abuse them. It doesn't work like that. Everything is very carefully planned, so they're very tactful in terms of how they execute that. And these are some of the signs that parents can actually look out for. So singling one child out and treating them as special. So if you have 4 children, or you have 3 children, or you have 2 children, for example, they will choose one, okay, or they'll choose 2, but they'll make them out to be very super duper special children. Buying them gifts, making wonderful comments about them, and that's the grooming stages where they want to create that bond with that child. Taking an over interest in treating over interest in the child and buying them gifts, arranging special activities or spending extra time with them, isolating a child from adults or children. Like sometimes I've seen people say to young kids, you know, they'll say, I want to go to the park, for example. They'll say, okay, let's you and I go to the park, or, you know, we can spend some time together. Encouraging a child to use alcohol or drugs usually can happen, and I've seen that quite frequently recently. So they will forcefully make them use alcohol, and that's their way of manipulating the child. And the child, you know, being young and naive, won't know what actually happened to them once they use drugs or alcohol. Insisting on physical affection even when the child doesn't want to. So even if the child says stop, you know, continuously trying to touch their face or their neck area or showing them affection, that's still not acceptable. And being exceptionally helpful in supporting your family, either financially, emotionally, or practically, you know, like over and above, you know, because that's how you develop bonds with the family, and that's how you take over control of that young child. Some of the behavioral signs of sexual abuse. So even though a child may not verbally tell you that they've been abused, but they may say or do things that provide some clues. And these are some things that, you know, parents should usually look out for. Unexplained accumulation of money or gifts, aggression, destroying property, substance use, poor self-image, poor self-care, and lack of confidence. Because oftentimes the tactics that they use is that, you know, you're only for me. You know, nobody else would ever love you. I'm the only one that is attracted to you. So that damages. And can you imagine a child who's, you know, 5 or 6 or 7 years old going through that in those early stages of their development? They don't even know about self-esteem or self-confidence at that age. Sexual behavior or knowledge that is advanced or unusual. So if they're 4 years old and they're talking about like penetration, a 4-year-old doesn't know that. A 4-year-old doesn't know the extent of, for example, sexual intimacy between couples. So that would be an alarm bell. Like, that's unusual for them to say something like that. Not wanting to be left alone in particular with a particular individual, and not wanting anybody to touch them. So say, for example, young girls, when they go to the toilet, they don't want anybody into the toilet, and they'll, you know, throw a tantrum because they're too afraid of what the outcome would be if somebody else goes in the toilet with them. Changes in behavior, so can either become very withdrawn, anxious, aggressive, or very fearful. Difficulty concentrating, on memory loss, or declining school performance. If you had a child who was like a top grade student, and then 6 months later or 12 months later their school performance is really poor, then it's not really a lack of intellectual ability, it's more that the child must have experienced something, and you need to explore that. Disordered eating or preoccupation with the body. So sometimes they might eat, really big amounts and start binge eating, and then others, they might have no appetite, and then they might be very focused on their private parts, for example, or their breasts or the private parts of males. They'll be very obsessed with it. Excessive compliance or a desire to be overly obedient, um, and persistent sexual themes in drawing, stories, and play. Running away, recklessness, suicide attempts or self-harm, sleep disturbances, excessive masturbation can also happen, particularly, after the age of 5, and it can happen in public as well, because that's all they know, and that's their way of, sort of normalizing it, because it's been normalized to them. Unusual or repetitive soothing behaviors, so hand washing, pacing up and down floors constantly, and inappropriate sexual play with themselves, other children, toys, or dolls. That's quite common as well. There's some behavioral cues that parents can become really, really aware of. And some of the physical signs of sexual abuse is difficulty sitting, walking, bowel problems. If they had no bowel problems, they can, their bowels can become very loose, or severely constipated. Psychosomatic illnesses such as abdominal pain, headaches for a young child at that age, especially when they're 11 or something, that's unusual. Having torn, stained, or bloody clothing, especially underwear. So parents sometimes will say from different cultures, that they must have been riding a bike, for example, or they did gymnastics and they did the splits, and that's how they got, and the perpetrators will tell them this story. They will actually train them for this and say, this is the reason why you're bleeding. And the first thing you do is you go home and have a shower, or I'll wash you before you go home. They might have frequent urinary tract infections or yeast infections. They could have STIs, so sexually transmitted infections, or bruising, injury, soreness, or redness around their penis, vagina, mouth, or their anus. So these are very common things. And if this is all of a sudden out of the ordinary, then it's really important that you explore that. And I think it's more about, and I'll give some advice at the end about how we should open the door so people can come forward and discuss these important things. In terms of the impacts of child sexual abuse, children who experience that will go through lots of emotional, psychological, and physical problems as a result of being sexually abused. And these effects can cause both short-term and long-term issues. Some of the short-term issues that we oftentimes see is regressive behaviors, promiscuous behaviors, sleeping and eating disorders, self-harm, suicidal thoughts, nightmares, zoning out or not listening, difficulty concentrating or memory loss, low self-esteem or lack of self-respect, poor attendance or performance at school, anger, aggression, self-destructive behaviors, increased illness, body aches, or other physical complaints. Long-term effects may include suicidal ideations, sexual difficulties. A lot of women will say that, once I got married, the experience that I had when I was sexually abused still lingers on. So, the breath, or the way he spoke to me, or the touch, or anything like that, which prevents them from actually having proper intimacy with their partner. Definitely post-traumatic stress disorder is number one. Alcohol and substance misuse. So a lot of young men and women who've been sexually abused will definitely use alcohol and substances to numb the pain. Engagement in risky behaviors. So if the child, the sexual abuse is normalized for the child, then what essentially happens is that the child will then continue to think that that's normal. So, and they then go into risky behaviors in terms of prostitution, drug dealing, because they think that, in order for me to survive, that this is my way of feeling accepted and emotionally connected with people. So they will do that, do that quite frequently. In development of mental health issues, so lots of anxiety, depression, trauma, um, if, if it's prolonged for longer periods of time, and having exceedingly high expectations about themselves. You know, they have to be better. They have to be better than the image that was given to them. Difficulty forming trust and positive relationships. So they will have lots of trust issues in relationships, lots of positive, you know, interactions with their partners in relationships, and having difficulty identifying their emotions and regulating it, because they don't know how to. Majority of the time, if you hear cases of sexual abuse clients, sometimes they'll say that when it actually happened to me, I felt numb, and I felt that it's better for me to accept it and accept the pain by shutting myself out than screaming and carrying on. That would have been very more painful. And either way, it wouldn't have made any difference, because the act would have happened as continuously. So that's why they struggle with identifying emotions and then regulating it. Confusion around their identity, their worth, and their sexuality. You know, they don't know who they are, because to them, they usually say, I feel like my innocence was snatched away without my consent, without my permission. Especially when you're 5, you know, especially when you're 8 and a little bit more intelligent, or when you're 11 and 12. You know, they'll say that is, I mean, I had a young girl, she was a practicing Christian, and she was 14. So sorry, she was 14 and trying to get to know someone. And she said, you know, I want to be with this person and I want to get to know him. And when I'm 18, I actually want to get married to him. But I feel that my innocence was snatched away because I'm Christian now, you know, and I want to be able to have that first experience with my husband, but I can't, you know, I can't have that experience with him. So that really lingers on for a very, very long periods of time. And if we look at it from an Islamic perspective, it's against Islam. You know, there's nothing in the history of Islam. I mean, I know it happens in a lot of Muslim countries, but in our religion, it's completely against it. But also in our religion, knowledge is power. So if you as a parent or as a friend or someone know that something like this is happening, even if you don't know, it's important that you educate young girls or young boys on the effects of what sexual abuse is like. So I'm going to give some tips on how to sort of go about it. The first thing is talk about body parts early. You know, teach your child the proper and you know, anatomy names for their body parts, such as penis, vagina, anus. Do not give them names. Do not say this is your doodle. Do not say this is your flower, and nobody can. We don't use names. We give them proper names, because when you give proper names, you're identifying it. That this is your you know, this is your vagina, for example, and no one is allowed to touch this. This is what happens to it. So we need to be very open about our discussions about those things. And I know in our culture, and particularly in Islamic households, parents struggle with that. You know, and I have had lots and lots of training with schools around this, that, you know, it's so important that we have open and transparent discussions with our children. How many of us can actually put our hands and say, you know, my mum and dad actually spoke to me about these things explicitly? I mean, we don't even know what periods are like, or, you know, when you get your periods, you don't even know what to do with it, you know, half of the time, because nothing like this is ever discussed. So it's really, really important that to prevent your child from experiencing sexual abuse at any point in their life, that discussion is had really early on. Let your child know that their body belongs to them. Okay, because perpetrators will use this to their advantage. Most of the time, they will say that, you know, you're a woman or you're a young girl, and you're 7 years old, so you need to experience these things. So no, you're 7 years old, you don't need to experience anything like that. So talk about the difference between safe and unsafe touches. As an example, you know, my daughter is 6.5, but when she was 4, I already had these discussions with her at 4. So because she needs to understand what is a safe touch, what is an unsafe touch, and they have the ability to say no to a touch. You know, that makes them feel scared or uncomfortable. They can say, "Please don't touch me." So they need to learn create those boundaries themselves, because then perpetrators won't go to those ones. But if a child is not assertive enough, then that's leverage for them. You know, they take advantage of something like that. Teach them that some body parts are private. You know, tell your child that your private parts are called private parts because they are not for everyone to see or everyone to touch, or that it's yours and that it belongs to you. And teach your child body boundaries. Explain body boundaries, and that it is okay. It is not okay to anyone to touch it, or ask them to touch theirs. Right. So when we do that, we are trying to create really good boundaries. That if somebody comes up to you and says, you know what would it be like? Or, you know, because children are very curious beings, right? So when, you know, we live in a very hypersexualized world. So everything is about sex. Instagram is about sex. Facebook is about sex. Snapchat is sexualized. Every WhatsApp messages are sexualized. You know, once you hit the age of 11, everything is hypersexualized. You know, look at the advertising. Look at the shows. So children need to create boundaries. So when they have those boundaries, then they know that, you know, I'm not curious about somebody else's genitals. I shouldn't be curious about that. Talk about body clues. How the body can give us warning signs when we are not feeling safe. You know, so there's oftentimes children are very super intuitive, so they know what makes them uncomfortable and what makes them comfortable. So, you know, you can teach your child that, you know, talk about body clues. So what are some of the warning signs? You know, things like, he makes me very uncomfortable, I get very I feel like my heart's racing, or I get anxiety or butterflies in my tummy. And if that happens, then you know what, walk away from that. You don't need to be around that person. Tell your child that your body secrets are not okay. So, for example, telling them that no matter what anyone tells them, secrets about their body are not okay, and that they should always tell you if someone tries to make them keep a body secret. Right. So oftentimes parents will say, you know, this is a secret in the family. Make sure you don't go and say anything to anyone. No, that secret is different. Body secret is different. When it comes to your body, it's not a secret. So you make sure you tell mum or dad about it. Teach your child how to get out of scary or uncomfortable situations, you know, such as no or stop or screaming. You know, that they need to be able to verbalize that. Even so, it's with the parents who can empower and encourage the child. A young child doesn't go to anyone but their parents for advice and assistance. So if they come to you for that purpose, then it's your responsibility to be able to teach them that. And use appropriate resources or games, particularly if the child is not intellectually advanced, because every child does develop very differently. Every child does develop emotional intelligence at different stages. So it's really important to teach them that based on their level of understanding. And oftentimes games and resources is about reinforcing safety messages, and to help the child recognize, react, and report when they don't feel safe. So I know in every state across Australia have specific child protection agencies, but there is a list that you can go on kidshelpline.com.au, and they give you a rundown on all the organizations that actually give you guidance around that. And also there's lots and lots of resources available that you can actually go and have a look at with your child. And even if your child is, for example, like 11, 12, and they have easy access to the internet, they can read, I would actually sit there and get them to navigate the resources themselves. because you know, and it's giving the control to the child and say, you know what, this is what you need to investigate and tell me what you learned. That's what I would probably do if my child is like, you know, 12. I would actually get them to investigate that site, for example, come back and then have that discussion with you. And I would expect that the parent would have done that as well. So the discussion is quite transparent, and there's more understanding there. Um, so yeah, look, in a nutshell, that's what, you know, child sexual abuse does to people, especially young girls. And I've worked in the trauma sector for a very long time, so I have seen some of the worst cases in New South Wales. So it's not something that should be taken lightly. It should be taken very seriously, and I'm a big believer that if we can educate our community and educate parents earlier on, then yes, we have hope for the future. But if we're still going to continue to live in the stages of denial and continue with the stereotypes and the stigmas, then we can't move forward with something specific as a child sexual abuse.
Yeah, totally. Wow. Mashallah, sis, that was pretty informative, and yeah, like it just shows that you've given beautiful, like, great signs to look out for. You know, we should definitely be more aware of these signs, and yeah, and you know, I just want to say a very big thank you for all the information and your insight on such an important topic. Really, it was a great honor. I don't know if any of the sisters have got any questions for Sister Nesrine, but no one's posted any that I can see. But yeah, it was a great honor and delight to have you amongst us.
Pleasure. Just before I go, in terms of if there is, if someone who may have experienced this or who's triggered by it, then may I recommend, based on which state you are from, to access helplines that are out there. I know in Sydney we have the Hayat line, crisis line, that people can access. I'm just gonna get the number for you. You can access that in Sydney, and you can access it everywhere actually. So it's pretty much national. So people can call. It's a anonymous service that you can get crisis support. The number is 1300 993 398. So if anyone's going through something like this, or have experienced someone or their family member or someone's disclosed something to them, then it's important that you seek assistance as soon as possible.
Yeah, mashallah, sis. Yeah, this is a very important topic that definitely not just our culture, but in every culture as well, but definitely in our culture, that it's something that you know, you can't imagine it being discussed and, you know, our parents talking about it. No. Yeah, but I guess the new generation should be more aware, like we're more, you know, yeah, and take, like, really, especially like you said, because we've got technology now, and everything is sexualized and everything is more, you know, it's all about that. So we need to be more aware, and as parents, and you know, look out for these signs and guide our children, you know, because they're very vulnerable, and they, you know, it's our responsibility to
So, and I've had I've had young girls always tell me that you know, when they're online and on Snapchat and you know, on Facebook, a lot of these men will go, or a lot of the women will pretend that they're also 16, and then they'll ask them for nude photos. And then because they're so vulnerable and they want this, you know, this world is all about acceptance, so they want to feel accepted and loved, and so they will send them nude photos, and then they use that as bribery. You know, like, if you don't do A, B, and C with me, then I'm going to show your parents these. So that's another tool where we can educate our children. Like, you don't need to send naked photos to anyone. You should be able to preserve your body for yourself, and no one else, as a matter of fact. So that's another important area, because they're using a lot of online, and perpetrators have a ring. It's like a cult. It really is like a cult. They all connected. They all know one another. They know the tactics. They know the manipulations. So there's lots of discussions between them about, you know, how they should go about doing things. So it's really important that we, especially in the online area, that we educate children.
Yeah, because it's much easier for them now, you know, to do it, because like you said, if they just get one thing from them, then they're stuck. Like the children are stuck. Absolutely. Because then they have to obey what they say. Whereas before, like, so with all these photos and technology, you know, they use that for their advantage. Definitely. So it's more scary, and that's why we need to definitely you know, may Allah reward you for talking about these and making it really black and white and clear, you know, on such a, you know, taboo subject, really, like that doesn't get discussed. So may Allah reward you. And also I just want to say, you do amazing work. May Allah reward you for everything that you do. We make dua for the success of all the projects your committee is doing for our community. That empowers the Muslim Australians to be heard and supported. And thank you to all those who've tuned in today. And from the team at Melbourne Muslims, we would like to wish everyone of you a wonderful Ramadan Mubarak. And Assalamu alaikum wa rahmatullahi wa barakatuhu. Inshallah, we'll see you again. We see you again, sis. Assalamu alaikum.
Thank you.